Hello everybody, this is Dr. Ryan at Primal Chiropractic, and thank you for taking the time for watching this video on diaphragm breathing. The first step we need to do before we diaphragm breathe is find neutral in our spine. So as you can see on the far left-hand side, this picture is indicating pure neutral because of those parallel lines. As you can see, one is at the mid-back and then the other one is around the pelvis region. With the other pictures, you can see when the spine is out of neutral, either curved too much or too little, it creates unparalleled lines, and this does not allow us to utilize our diaphragm muscle, which is the muscle that contracts when we bring oxygen into our body, and ultimately that's going to support our core and our back. So the whole purpose of proper diaphragm breathing is to regulate intra-abdominal pressure to increase support for the back and spine. Now, when it comes to our core, we want to visualize it as a 360-degree chamber and not just the front of our abs where we typically see that six-pack at. So when we do our diaphragm breaths, it's important not to only pressurize through the front, but also through the sides and also through the back, creating that 360-degree diaphragm breath. Unfortunately here, these are not six-pack lines. These are abdominal creases. Now, if you notice you have these creases in your abdomen region, this is a direct sign that you are unable to pressurize in that direct area and it has collapsed on you, and this is a direct sign of weakness in your abdomen and core. So a great way to stimulate this is to pinch those creases, lift them up like a tent, and diaphragm breathe into these regions to help correct this problem area. Before we diaphragm breathe, we need to find neutral in our spine. So grab a chair or get next to a sofa to relax your legs on. If you have too much space underneath your low back, you are out of neutral. You should not be able to slide your hand underneath your spine. And vice versa, sometimes when we tuck our knees in too much and you are able to slide your hand underneath your glute area, you are also out of neutral. Pure neutral is where you can feel your low back firmly into the floor without any space underneath your small of your back or any space underneath the glutes. From here, you can put a hand on your abdomen and a hand on your chest and start your diaphragm breathing. There should be absolutely no chest expansion as you diaphragm breathe, and the breath should be pulled low into the abdominal region. And you should start to feel this 360-degree expansion. Again, not only through the front, but through the sides and also through the low back. The apex of the diaphragm breath should be very close to belly button level or slightly below. So meaning that's the highest point of your abdomen when you inhale. Once you can do this comfortably, the next progression is going to be elevating the legs in the air to engage the core. You'll notice it's a little bit more difficult to still do the diaphragm breathing while engaging the core and embracing the abdominal region. And this is important because with a lot of the exercises we do, you're not going to be in that relaxed position, and you need to understand how to be able to diaphragm breathe while actively engaging the rest of your body. Next, we're going to talk about coordinating the diaphragm breath with certain strength exercises and rehab exercises. So with the deadlift, the hardest part of the deadlift is at the bottom right there. And so we would want the most amount of pressure and stabilization in our back and spine during that moment. So it would only make sense as you go down into your deadlift to inhale, because right there I have the most pressure. And then as I come up, I can start my exhalation process. Same thing with the squat. At the bottom of the squat, it's the most difficult portion of the squat, so you would want the most stabilization in your core and abdomen. So you're going to inhale as you go down, and then as you come up, the squat becomes easier, so you breathe out as you do so. When it comes to the push-up, the bottom of the push-up is the most challenging part of the exercise. So inhale as you go down, exhale as you come up, because at the top of the push-up, it's the easiest, and you can be weakest with your stabilization at that point. Now, there are certain exercises that don't require breath coordination, such as the suitcase carry. There's really not a going up and down or easiest hard part of the exercise. It's very level. So with this example, you just want to continuously diaphragm breathe throughout the process, pulling every inhale towards that belly button as you go. So for the majority of our strength and rehabilitation exercises, we do want to use the diaphragm breathing technique. However, there is some exceptions to the rule, especially when it comes to exercises that require maximum oxygen intake. This is where it is very acceptable to be a chest breather. An example would be during a sprint. Our nasal canal is too narrow to bring oxygen in and out during something that intense. So this is the exception of the rule where you can be a chest breather to bring oxygen in and out. However, we don't live in this state constantly. So throughout the rest of your day, whether you're relaxed or doing any sort of these exercises, make sure that you utilize that diaphragm breathing technique. If you guys have any questions, please feel free to email us at info@primalchiropractic.com or call us at 708-671-8082.